the body doesn't work in systems, even though our healthcare system is set up in systems. If you don't get the immune system stabilized, you're at risk for developing other autoimmune diseases. They're just told that this is life. Like, get used to it. They either feel like they're a hypochondriac, or they say, of course, you're supposed to feel this way because this is menopause. You're not supposed to have those symptoms as we age. The body is not supposed to degrade like that.
All right, welcome everybody. Today we have with us Dr. Heather Stone, who's out of Houston, Texas, and we're going to talk some thyroid stuff. So Dr. Stone, I guess if you don't mind, maybe just give us a 1-2 minute intro on who you are, in case people don't know anything about you.
Yep. So I am Dr. Heather Stone, and I started on this whole thyroid journey with my own thyroid issues several years ago. I was dealing with the same low thyroid symptoms that most women are dealing with. I couldn't lose weight. I was about 50 pounds overweight. I had hormonal imbalances, and I wasn't really getting anywhere in the traditional Western medical model. And so I figured, this is not going to be my life. I have to figure this out. And so that's what really started me on my own health journey, and what led me into functional medicine and really getting down to the root cause of, what's really at the heart of these disease processes, and why are we suffering from all of these issues. And so, that's my passion. And I've been working with women with low thyroid for over 23 years now.
Yeah, it's interesting. I think every physician I've talked to that sort of has this sort of leaning towards root cause medicine, functional medicine, whatever have you, kind of a little bit different from the traditional allopathic stuff, has had a personal experience with health, as did I. I mean, I was just like, I wasn't super sick, but I was just impressed on how much nutrition made me better.
Right.
So let's talk about, I guess hypothyroidism is probably the most common condition you probably run into. I mean, there's, Hashimoto is a very common autoimmune, probably one of the most common causes for thyroid. Correct me if I'm wrong on that. And then, of course, on the other side of the spectrum, we have like Graves' disease, where we have, and I'm sure there's other variants in there. But what are you seeing most often? And are we at a point where we can talk about causation for this at all? Do you think there's any sort of thought like what causes hypothyroidism?
Well, I think for us, and what we can see with the research and what I see in clinical practice, is the most common cause of hypothyroid is autoimmunity and Hashimoto's. Mm-hmm. All right. So that essentially, for the people that don't know, Hashimoto's is an autoimmune condition where the immune system makes antibodies to tag the thyroid tissue for destruction. And the research is showing about 90 up to 98% of women who have low thyroid actually are dealing with Hashimoto's. So the immune system is essentially killing and attacking the thyroid, causing this low thyroid condition. And so, you can go deeper and say, well, why in the world are we dealing with what seems like an epidemic of Hashimoto's and autoimmunity? And then, I think there's more speculation, and there's not a lot of hard evidence, but we live in an ever toxic world, and the toxic load that we are dealing with today is higher than it ever has been.
Yeah, for sure. And it is something that, autoimmunity across the board, whether it's, Hashimoto's or Crohn's disease or RA or psoriasis, or, I think there's literally hundreds of autoimmune diseases that have been described, is definitely on the rise. And, that's something that I have an interest in, is like, why? I mean, yeah, we know it's autoimmune, but why? Why is our immune system going haywire? Why is it attacking itself? My suspicion is a gut plays a significant role in that. I don't know if you agree with that, but I mean, that's been my sort of observation, and I think when you often help that. So, so the antibodies, I think it's what anti-TPO and anti-thyroid globulin are the typical ones that I think that are elevated in this situation. And so, what does it look like clinically? Because there's some people who don't even know what hypothyroidism is. What is that? How does that present?
Well, essentially, the classic symptoms of hypothyroid is the inability to lose weight. So women find themselves gaining weight slowly over time, sometimes rapidly. And it seems like nothing that they do works. And then, they will also deal with anxiety, depression, insomnia, where they can't fall asleep or stay asleep. their hair starts falling out, their skin gets really dry. Those are the classic symptoms of hypothyroid.
Okay. And well, how's it traditionally treated? And well, I don't know. Maybe I don't know. How do you? I guess we could talk about the traditional treatment, and maybe you have a different take on that. So, what's the traditional treatment for hypothyroidism?
Yeah, so typically when a female starts to experience these symptoms, so usually we try to push through and we try to solve it ourselves, and we go through every fad diet known to man, and we increase exercise, and we usually don't get very far, and we feel even more depleted. So finally we go into our doctor's office and we say, okay, I've got low energy, I can't lose weight, I'm not sleeping well. They're like, oh, that sounds like low thyroid. Or with these days, we have so much information. Maybe they go into their doctor's office and say, I think I have low thyroid. Can you please check me? And so they run the typical thyroid labs, which usually is a TSH. Maybe they get a total T4. Maybe they get a T3 uptake. And so those labs likely will come back, okay, you've got hypothyroid. Here's your thyroid medication. And that will be some combination of whether it's T4 with Synthroid or levothyroxine, or they might do a more combination or give them some T3, something a little more on the natural side, which is Armour thyroid or NP thyroid. And they say, okay, you're going to feel great. Just take these hormones and be on your way. And a lot of doctors will say, okay, come back in 6 weeks or 2 months. Sometimes it's 6 months, sometimes it's a year, to check to see if these hormones are right or have they leveled out in the body. And when they go back, they may need some adjustment in their medication to get their hormone levels optimized. But for the most part, if the lady experiences an improvement, it will be short term. So they take these thyroid hormones, you get a short burst of thyroid hormones in the system, and sometimes the symptoms go away or lessen, but they eventually end up coming back. And the reason that the symptoms usually come back is because when you put in thyroid hormones, it's never usually the main cause. It's never usually the primary issue. And so when you start to dig and you say, okay, well, let's get down to the root cause and let's really fix why these symptoms are here, what you start to understand and realize is that when you have an autoimmune condition, that is more of the primary issue or the reason why we actually have low thyroid hormones. And so for me, I want to say, okay, well, what are all the triggers that are causing your immune system to attack the thyroid? And this is really, really important because when you have one autoimmune disease, you're at risk for developing multiple autoimmune diseases. So if you talk to most people that have an autoimmune condition, they're like, yes, I've got Hashimoto's and I have RA. And I have lupus, or yes, I have celiac also, or Sjogren's or Raynaud's or whatever it is. And so in order to prevent all of these additional autoimmune issues, you have to create balance in the immune system. And this is also important because when you have Hashimoto's, you're at an increased risk of developing thyroid cancer. So this goes to your point. Well, I think, we have to look at the gut because the gut plays a really big role in autoimmunity. So when you look at what are the possible triggers that could be making the immune system attack the body, we have to first look at glucose and insulin surges, because every time you have an insulin surge, it can make the immune system attack the body. Secondly, we want to look at your hormones and cortisol levels and how well your body's handling stress and how much stress your body's actually under. We want to look at food sensitivities. We want to look at mold toxins, biotoxins, heavy metals, environmental toxins. And then we want to look at underlying infections as well. So the gut plays a big role there, but I think it's important to understand that the body doesn't work in systems, even though our healthcare system is set up in systems. Like if you look at the gut, you can't balance gut health if you don't fix blood sugar. if you're not looking at food sensitivities and other inflammatory processes. So you have to really look at the body as a whole, and you have to do the appropriate testing to understand, okay, what is this person dealing with? What are these person's triggers? And then what is it that we need to do to create resolution and balance in the immune system?
Is there any understanding as to why it seems like, at least for many of the conditions, Hashimoto's for sure, maybe MS and some others, it seems to have a greater preponderance of the patients are female? Is there some? So I've heard people say, because of pregnancy, you're exposed to antigens from the fetus, and maybe that has something to do with it. Is that it, or is there some other issue? I don't know if they've looked at, women that haven't had kids versus women that have had kids and seen if there's a greater rate of autoimmunity. But why do women seem to be disproportionately affected, at least by things like Hashimoto's? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Well, I don't know if there's a lot of research there, but I will tell you just from my clinical experience and what I have kind of gathered, one of the triggers of autoimmunity is surges in estrogen and testosterone. And so you tend to see Hashimoto's turn on at three main places in a female's lifespan. And it's usually when they go through puberty. So when we have those big fluctuations in our hormones, most of the time it's after the birth of a child. So your immune system does have to flip-flop into, a dominance to keep the fetus. And sometimes after you have the baby, the immune system doesn't necessarily shift back. And then as we start to go through perimenopause and menopause, we have more hormonal shifts and fluctuations. And so I tend to see it either turn on in menopause if it hasn't previously, or the symptoms get worse and they kind of go into more of an autoimmune presentation. So my theory is that we have more hormonal shifts and fluctuations in females than males. And I will say I have seen males that do have Hashimoto's, and it's almost always after a really big stressful event, like a loss of a job, a loss of a family member, a move, or a divorce or something like that. So big stressful events can create this issue in men, but I think it's more prevalent in women because we have bigger shifts in our hormones at different phases of life.
Okay, so here's a big question. Can you reverse it? Can you not have Hashimoto's? Can you be I just want to see what your perspective is on that. Is it something you can take a woman who has symptoms, tired, fatigued, cold, can't lose weight, maybe gut issues, and can you turn that around?
So you can absolutely turn it around, and the ultimate goal is to put it into remission. So what does that mean? Well, it really means that are these antibodies going down? Are your symptoms all improving? Is your blood sugar regulated and your gut health better? And we literally see this every single day. And so, I don't think it's necessarily like you weren't successful if you have antibodies that are low and stable. I would say that that's pretty good, and you have zero symptoms. That's really a great win. For me personally, I have Hashimoto's, which I mentioned earlier. This is kind of what's set me on this mission. And I check my labs probably at least every 6 months. And my antibodies have been almost identical, and they're probably in the 50s. So it's still there, but it is not moving. And I have zero symptoms. So for me, I'm like, it's stable. If I can keep it there, I'm doing a great job and not developing all the other autoimmune issues. But ultimately, you want to see these antibodies within the lab range. But it's not always like perfectly reliable, those lab ranges, when we look at these antibodies, because there is a 20% error rate in that test alone. And sometimes your immune system can really start to underfunction, and you still have all of these symptoms, but the antibodies are negative, and it doesn't necessarily mean that you put it into remission. So we can't always rely on those antibodies and that be like the holy holy grail of what it is that we're evaluating if somebody is actually improving, getting better, and moving it into remission.
Yeah, I mean, I'm a big proponent of looking at actual clinical symptoms and not so, I mean, the labs can be supportive and informative, but I mean, ultimately, and what the patient actually cares about is how do they feel? I mean, are they
Yeah.
symptomatic or not? That's the ultimate goal there, I think. With regard to, so you said, you're asymptomatic, your labs are stable. Are you on replacement, or is that without any medication? What's the story on that?
For me, I'm not on any medication because honestly, I caught this very early. I knew what to look at. It really, the Hashimoto's for me turned on, at least from what I know, because this is when I started checking it, is after the birth of my first child. So at that time, I knew that I really needed to focus on immune function to protect thyroid health. And so for me, I don't have to take thyroid medication or thyroid replacement, but I will tell you my lifestyle is all centered around how do I optimize health? What's my blood sugar look like? How are my hormones? Am I being active? And am I living the life that I'm trying to teach patients how to live? And so it's really my life, but I have tried everything I can to protect my thyroid. And I was first diagnosed with Hashimoto's. How old is my oldest? He's almost 22 now. So for about 22 years, I've known.
No, good for you. That's wonderful. We talked about a little bit about replacement. You talked about Armour thyroid versus Synthroid, and the more sort of one that's typically used. I think I heard that they were trying to get rid of Armour thyroid or something. I don't know if you heard something along those lines. I thought so. There's a push to try to make that not available or illegal or something like that. I don't know. What are your thoughts around if you're going to be on hormone replacement, particularly thyroid replacement? What is appropriate?
Yeah, and I think a lot of people and doctors get hung up on which replacement is appropriate for everybody. And I think it's really important to understand that each person has their own unique way that their body is functioning, right? So we can get dogmatic about saying, well, Synthroid is the best because it has a very precise dosage. Every single dose, you know exactly what you're getting. And then, there's another camp that's like, well, it needs to be more natural. It needs to be more bioidentical, and Armour thyroid is much better. But you're not always getting the exact dosage because it is more natural. And yes, the FDA was trying to get rid of Armour thyroid and more of any of the porcine, but I think that's been squashed. I think that is no longer on the table. There were so many people that really is the medication that they need to help them the most. Now, it's important to understand how the body's functioning, because I have some patients that come in on Armour thyroid and we look at their labs and their T4 is extremely low, but their T3 is really high. And so their doctors are like, I only want to give you Armour thyroid, but yet their T4 is super low. And it's important to understand that when you have low thyroid hormones, that it can be a trigger to the immune system, right? So if T4 is low, it will trigger the immune system to attack the thyroid. So maybe you would need more of a T4 hormone like Synthroid or levothyroxine and not just an Armour thyroid. And vice versa, because you can have good and level T4 hormone, but your T3 is really low because you have an underconversion pattern. And we can get into why we have underconversion and what that might mean. But T3 is your active form of thyroid hormone. So if you have a lot of T4, but you have really low T3 and your TSH looks normal, you can still have all of those low thyroid symptoms. And you can feel like the thyroid medication isn't working because you have that underconversion pattern and it never really gets looked at.
I mean, as you mentioned at the beginning here, the typical screen for hypothyroidism or hyperthyroidism for that matter is often just a plain up TSH, thyroid stimulating hormone. And the thought is, that, it's if it's normal, then the thyroid is adequate because the pituitary isn't, sensing low hormone. But is a normal TSH always associated with normal thyroid function? Or is there some nuance to that? And conversely, is an elevated TSH always associated with a negative disease state, I suppose.
Yeah, I think we have to look at and understand where TSH comes from. All right, most people don't even realize that the TSH, it stands for thyroid stimulating hormone. It comes from the pituitary. So you can have issues at the pituitary level where the pituitary is under functioning and it looks like your thyroid is normal, or it could look like you are over medicated or even in hyperthyroid. And then you look at your thyroid hormones and they look good. But you would only know that if you were actually looking at all the other thyroid hormones. The other thing that we want to understand and know is that TSH is typically, for the most part, responding to T4. Now, that's not to say that there isn't some feedback with T3, but mostly the TSH is responding to the amount of T4 in the body. So you could have an underconversion pattern. So what that means is the thyroid mostly makes T4. And that T4 is, for the most part, inactive. The body has to convert T4 into T3, and that's the active form of thyroid hormone. So this underconversion pattern is really prevalent. It's very common, where TSH looks completely normal, T4 looks good, but you have low T3. And so that's why, we go into the doctor and they measure TSH and they're like, your TSH is fine. Your thyroid is fine. But then they're like, but I still have weight issues and I'm still exhausted and I'm not sleeping at night. And so because they're not looking at that underconversion pattern, then we start to get put on antidepressants and sleeping pills and, all weight loss drugs and things like that without actually looking to understand the root cause.
All right. And so, I don't know if you want to talk, do you focus much on some of the other like Graves' disease? Is that something with it that you spend much time dealing with? And if so, we could talk about that. And then I want to get into how do we treat this stuff, because that's why people are listening, quite honestly. But
yeah,
any thoughts on the Graves' disease, the opposite side of the spectrum?
Yeah. So Graves' disease, it's really important to know. Well, first of all, Graves' disease can become a medical emergency. So it really needs to be handled, appropriately. Usually they either take the thyroid out, they do radioactive iodine to kill the thyroid, or there's other things that they can do, other medications that are anti-thyroid medications that they can go on. Now, it's important to get that treated, but then at the end of the day, you have to step back and say, okay, what is the nature of Graves' disease? And the nature of Graves' disease is essentially the same as Hashimoto's or any other autoimmune disease. In Graves' disease, it does attack a different part of the thyroid. And so you have to say, okay, once you have that kind of emergency state, that super hyperthyroid state handled, you have to say, okay, they got rid of the thyroid, they killed the thyroid, or they're giving you anti-thyroid medication. But at the heart of that disease, it's still an autoimmune condition. So if you don't get the immune system stabilized, you're at risk for developing other autoimmune diseases. And so you have to take it from that approach. So I help many patients that have been diagnosed with Graves' disease, but after they're out of that acute phase where they could have a stroke or a heart attack or all that crazy stuff that happens when you're in major hyperthyroid. But again, it's an autoimmune condition, and you have to get down to the underlying triggers that are causing the immune system to attack the thyroid.
Let me just a little sidetrack here. Talk to me about iodine a little bit, because a lot of people are, they're like, I got thyroid, I need to be on iodine supplements. What are your thoughts on iodine?
Well, this is a bit controversial, and it's interesting that it is controversial because when you read the research, iodine is the worst thing that you could possibly do for Hashimoto's. So when you take iodine, it actually increases those antibodies. And interestingly enough, there was a huge increase in the prevalence of Hashimoto's after they iodinized the salt. In every country where they iodinize the salt, Hashimoto's increase exponentially. And so, there is, I always think about, as I was learning about the thyroid many years ago, the thyroid has an iodine trap. So it will hold on to iodine because iodine is really important for thyroid function. So very rarely does the thyroid ever run out of iodine. And we get iodine from the foods that we're eating if we're eating a good, whole foods diet. And I think it's really important to understand that I was in a group meeting and I was presenting, and one of the attendees was like, Dr. Heather, I've been told to take a whole bunch of iodine. And she says, I'm not feeling good. My antibodies are through the roof. And I'm supposed to be taking this super high dose iodine. And the practitioner said, just keep taking it because you'll go over it and then the antibodies will come down. She's like, it's been months and I just feel terrible. And I said, all right, I gave her my opinion like I just gave you. And I said, don't just take my opinion. I want you to go research. Just go on PubMed, just go in and search up iodine and Hashimoto's. And she said, I did. And I can't find any data that supports me taking iodine. And I said, okay, well, it is your choice. And, you have to make those decisions because it's your health. But I want to empower you to make that decision based on, what you're reading, what you're researching, and how you feel. But for me, I do not give my patients iodine. And I really try to steer clear of that, especially with Hashimoto's.
Fair enough. So as far as, so you'd mentioned blood glucose control, you'd mentioned gut health. Obviously there are, I guess, situations where replacement is appropriate. How do you in general deal with this? Not every person's the same, but are there some generalities that you see that have to be addressed?
Yeah, so I would say this. For me, in my clinic, we do very extensive testing so that we can customize care based on each person's individual imbalances. But in general, I think one of the most important things that you can do is to get your blood sugar regulated. And at the heart of every chronic degenerative disease is a blood sugar problem. And if that's the only thing that you did, that you would be making huge headway in stabilizing not only your immune health, but your gut health and your thyroid health. And when I say stabilizing and regulating your glucose, dysglycemia is a term that I use a lot. And dysglycemia, all it means is that your blood sugar is dysfunctional. It doesn't mean that you have insulin resistance. It doesn't mean that you have prediabetes or diabetes, although those things do count. But a lot of people think they don't have a blood sugar problem because their doctors have told them their blood sugar looks good. But when doctors typically are saying your blood sugar looks good, they're looking at an A1C and essentially they're saying you're not diabetic or you're not pre-diabetic. But blood sugar issues start many decades before you ever get that actual diagnosis. And even being hypoglycemic, meaning you have low blood sugar, is a state of dysglycemia. And that's almost what starts the whole thing. And so getting your blood sugar stable. So a lot of people have blood sugar variability where their blood sugar goes down, it goes up, it goes down, it goes up all day, and they're having insulin surges. And every time you have an insulin surge, you're going to stimulate your immune system to attack the body, but also you're storing fat. Also, you're creating these inflammatory processes that impact your brain and your gut. So getting your blood sugar stable is the number one and most important thing that we could do.
All right. And so the obvious question is, well, how do you do that? How do you get your blood sugar stable? I mean, I have my thoughts, but I mean, I'd love to hear yours.
So my thoughts are you have to really work with the body, and depending on where you're at, right? I work with people who are diabetic. They've been diabetic for a long time. And I work with other people that just have some dysglycemia where they've got some, low blood sugar and high blood sugar issues. So it depends on where you are, and that would depend on what would be appropriate treatment. But you have to take the body from fat storing into fat burning. And a lot of times we get frustrated because we just try to go right into ketosis when we've been in fat storing for a very long time. And sometimes the body has a hard time adapting. So for me, I really do this on, if you take someone who's eating the standard American diet, I go through a process where we do more of an elimination phase diet, where we're taking out the things that are the most inflammatory, like gluten, dairy, soy, corn, grains. A lot of times people have sensitivities to lectins and oxalates. So we do more of an anti-inflammatory elimination phase diet. And then I move them more into working with their body to decrease carbohydrate intake. So really increasing protein intake. And then we move the body into more of ketosis, where it is high protein. We're playing a little bit more with fasting. We're really working to get the body into ketosis, where you're actually burning fat and your blood sugar becomes very stabilized.
Let me, what are your thoughts on goitrogens? Because I see people talking about that, certain like cruciferous vegetables high in goitrogens. And, for those who aren't familiar with a goiter, I mean, that's another thyroid issue that we often see, often in like developing countries more so. But thoughts on those, are they something to worry about, or is it just overblown?
I think this is also controversial. One of my mentors in the research I've read is that the goitrogens that you get in cruciferous vegetables don't actually cause a goiter or compete for iodine on the thyroid. Now, with that being said, there might be other things that you want to look at with cruciferous vegetables, whether it's lectins and other things that create a lot of inflammation. But I will say I have been able to get people to have reversal of Hashimoto's or get it into remission, no symptoms, and they're doing good and they're not eliminating those cruciferous vegetables. So I think that is, I think, in my opinion, that's been overblown. We should really be more focused on the vegetables that really raise your blood sugar, because blood sugar is more detrimental than those goitrogenic or cruciferous vegetables. Blood sugar plays a much bigger role. Now, if you want to go all the way carnivore, it's not necessarily going to, that's going to be an even better thing, right? But I find that most people have a hard time making a lifestyle out of carnivore. And I've done some research, and you've done, I think, a really great job doing that. But I think that most people, like the masses, I think that's hard to make it as a lifestyle. So if you can eat low oxalate, low lectin vegetables that are also low glycemic and eat high protein, that's going to be the best thing to stabilize blood sugar and create long-term results.
Yeah, I mean, for me, I never liked vegetables to start with, so that's not hard. Me giving up vegetables is not hard at all. That's like no big deal. I never liked them. But the other, I guess, what other thing I wanted to touch on, you kind of reminded me of something there. Yeah. So, okay. So I don't know if you're familiar. There was a recent study came out of China, I think last year. It was an MRI antibody study, and they did a low carb intervention. And they looked at, anti-TPO, I think thyroglobulin antibodies. They did MRIs of the thyroid and to look for swelling and inflammation. And they saw that by adding a low-carb diet, antibodies went down and swelling went down. So, I mean, it's consistent with what you're saying there. You're seeing that. So there's literature that sort of seems to support that. And I've seen it. I see it all the time. I literally see people with symptomatic hypothyroidism with high antibodies, and it gets better. Maybe not 100% resolved early on, but I mean, it's certainly putting them in the right direction. With regard to the gut, because I think there's good evidence that shows that gut dysfunction, gut dysbiosis, gut hyperpermeability, all are associated with autoimmunity. How do you address that? Because you talk about stabilizing glucose, but I mean, sometimes the gut still, even though glucose is stable, the gut's still messed up. How do we deal with that?
Yeah. So we got to look at what is causing the gut issues, right? So yes, stabilizing your blood sugar is key, but what else could be creating inflammation? So food sensitivity. So even though your blood sugar is regulated, you could be eating foods that you have a sensitivity to that are creating inflammation. The other thing that we look at is gut infections as well. So bacteria, yeast, fungus, parasites. So, changing your diet is going to help regulate your microbiome, but sometimes there's underlying infections that the body just can't resolve. So really handling those underlying infections is a big piece of the puzzle as well. And I think it's interesting because, we talk about gut microbiome diversity. You want to have a good diversity in your microbiome. And usually you would do that by eating a wide variety of fruits and vegetables. So now we have to think about, okay, is that actually true? Is that something that we should be doing? Can you do it eating more protein? So I think I don't know if there's a bunch of research out yet with that, but I think it's really important to decrease as much inflammation as you can. So we don't do a lot of gut detoxes or a lot of like probiotics, but instead handling underlying infections, decreasing inflammatory or foods that that you have sensitivities to, regulating your blood sugar, and then handling a high toxic load, whether it is mold toxins, heavy metal toxins, environmental toxins. I don't really think that we understand how impactful that is on the body, your gut health, and your immune system. But if you start to handle all of these things, your gut microbiome also starts to balance, and you start to restore the integrity of your the gut lining. And leaky gut, leaky brain, leaky lungs.
Yeah, I mean, you see a relationship when one membrane becomes hyperpermeable, they all do. We see it across the board, it seems to be.
That's right.
One of the things, with hypothyroidism, as you mentioned, a lot of people put on unwanted weight, and they have a hard time getting rid of it. And in part, blood sugar regulation is often more difficult when you have stored fat in the tissues and the cells. We see things like ceramides causing issues with the insulin receptor. So how do we sort of deal with that? Because, you're like, I want to stabilize my blood glucose, but because I'm too obese, it's really challenging. Is there a way to navigate that challenge? Because it's like you're in this sort of vicious cycle of I'm trying to improve my blood glucose, but because I'm maybe obese, I can't do it very well.
Yeah. So there's so many things at play when we talk about weight. And especially when you're obese, you have to think about, like, there's so many things going off in my head about what could be the underlying issue. One of the things I think is important is to realize that when you have a weight issue, it is simply a symptom that your body's giving you that something is not quite right. And so you have to really attack it from all angles that could be creating this situation. So just trying to stabilize your blood sugar is going to be very difficult if that's the only approach that you have. So we have to remember that there are obesogens, which is toxins that get stored in the fat as a protective mechanism. You have to look at your stress levels and your adrenal health and your cortisol levels, because that plays a role in your glucose regulation and your fat stores. We have to look at leptin levels, because the more fat that you have, the more leptin your fat cells produce, and the more leptin resistant you become. So the signaling is all off. So one of the ways that we start to handle this is to kind of lay it out on the table. All right, you've got a high toxic load. We've got to work on all of your detoxification pathways. We can clearly see that you're leptin resistant. So, you have to really improve the leptin sensitivity, and then you've got your whole glucose thing. So, handling all of those things at the same time is important, at the same time that you're really changing your diet. And I find a lot of people struggle because they're only focused on what they're eating to regulate their glucose instead of looking at the whole picture. I had another lady at that seminar that I was speaking at. She came up to me and she said, I've been carnivore for 6 months or longer. I can't remember. And she said, I haven't lost a single pound. And she was obese. And I'm like, really? She's like, no, I have not lost a single pound. And I just keep eating this way because I know it's got to eventually change. And I said, all right, you're doing the right thing with what you're eating, but let's check all these other things that might be going on that's preventing the body from releasing weight. And as you get into digging through all the underlying issues, you find other underlying imbalances. There is always a reason. So she was trying to manage her glucose from her diet, But what was really driving other glucose issues were all these other underlying imbalances. So the frustrating thing is that we continue to be told and we think that the only thing that impacts blood sugar is what we're eating. But I will say, you can't change your blood sugar without changing your diet, but it's usually not the only thing that needs to be changed when we're dealing with obesity and chronic degenerative diseases.
Yeah, I very much see that all the time. I mean, diet, I think, is a critical part of this process, but it's not the only thing. And, it's like for some people, you got to do 4 or 5 different things that make a big difference in that regard. As far as, okay, so the typical patient goes to a typical doctor, they're sluggish, maybe they get diagnosed with hypothyroidism. They get put on, 100 mics of Synthroid, a day, repeat labs, 6 months, he's progressing. What's going on? What's going to happen to that person typically?
Well, typically what happens to that person is their thyroid hormones become level-ish. It depends on what they're dealing with, right? Like some women who are dealing with autoimmunity, they never get their thyroid hormones stable. So the TSH is up, the TSH is down, the TSH is up, and every time they go, they get a change in their medication dosage and they never feel better. Why? Because they're never addressing the underlying root cause of this whole autoimmunity issue, and they're just addressing these numbers on the labs, and they're not really getting any better. The other instance is that they do get those thyroid numbers stabilized, TSH looks good, and they may feel better for a short period of time, but because they're more than likely dealing with autoimmunity, they continue with all of these symptoms, and then they have another chronic degenerative disease, they have another autoimmune issue, and they continue to get put on medication after medication, medications for symptoms, but also medications for diseases. And they're just told that this is life. Like, get used to it. They either feel like they're a hypochondriac, or they say, of course, you're supposed to feel this way because this is menopause. This is what most people feel like when they're in postmenopause. Just get used to it. Or they say, well, this is what it's like at your age. And so then we're just kind of stuck dealing with these symptoms. And for the most part, these symptoms, they're unnecessary. You're not supposed to have those symptoms as we age. The body is not supposed to degrade like that and so quickly.
Let me ask you a question about, I don't know what your thoughts on this topic that some people think is definitely an issue is thyroid resistance. We have insulin resistance. We have, presumably, you have a receptor, you have a hormone and a receptor, and I think the thyroid receptor, I believe, is on the nucleus, as I recall from maybe years ago in medical school, as opposed to cell memory. But regardless, there is an interaction that occurs, and you would assume that too little thyroid, too much thyroid, a receptor that works or doesn't work. You mentioned the conversion of T4 to T3, rather, primarily in the liver, I believe. But what do you think about thyroid resistance and the claim that a lower carb diet is going to tank your thyroid? What are your thoughts on that?
Okay, I'm going to take this from 2 areas. So thyroid resistance is a thing. Like hormone resistance, that is how the body works, right? So it's always trying to regulate. If you have too much of one hormone, the body has all these feedback loops where it's like, okay, I have too much of this hormone, stop making it. Okay, so you get that with estrogen, progesterone, testosterone, and thyroid hormone. So what that means is like, let's say that you have 10 receptor sites on a cell where thyroid hormone can bind and you can get the effects of thyroid hormone. But if you take thyroid hormone or you take a high dose of thyroid hormone, then the body senses that there's too much thyroid hormone or more thyroid hormone than what it's used to or needs. And so it down regulates those receptor sites. So let's say instead of 10, maybe you now only have 3. That's what we would say is more of like a thyroid resistance. So you have all of the symptoms of low thyroid. They look at your labs and they look at your blood work and everything looks good. But what's really going on is that you can have thyroid resistance and you just don't have enough receptor sites to actually bind those thyroid hormones. Now, as far as creating thyroid resistance from a low carb diet, I just have never seen that. I don't know. I just have never seen that in clinical practice. And I think if you are eating a bunch of carbs, you're creating blood sugar variabilities and insulin resistance. So I just have not seen any clinical indication that a low carb diet creates thyroid resistance.
What about the claim that it causes thyroid dysfunction or makes you hypothyroid by going low carb?
Oh, okay. So there is something that happens, and I do see this in practice where we start working with a patient and we're handling all of these underlying mechanisms. And all of a sudden, on their next blood work, we see their TSH go up. So if you don't understand and you don't know what's going on, you would think that that creates a hypothyroid situation. But if you're looking at antibodies, you also see the antibodies going down. So you have to realize with Hashimoto's, when the immune system attacks the thyroid cells die off and they burst with thyroid hormones. So it causes an artificially elevated state of thyroid hormone in the body. So when you go low carb and you start to handle all these underlying triggers, you will calm down the immune system, you calm down the attack on the thyroid, and therefore you decrease thyroid hormone in the blood. And so if you continue to work with the body, then that usually will level out or normalize, but you're getting a more realistic measurement of the thyroid hormone once you kind of calm down the attack on the thyroid.
All right, fair enough. Well, I assume you have do you have like a social media presence or anything like where people go to find out more information that you're putting out there? Do you have social media, website, or anything like that?
Yeah, so the best place to find me is on Facebook. We have a group called Happy, Healthy, and Lean Women Overcoming Low Thyroid. And last time I checked, I think we have almost 150,000 ladies in that group. And it is such an amazing group. Every single Thursday, I do Thyroid Thursday. And once a month, I typically do a masterclass. So that's a really good support system. I'm also on Instagram, but bigger on in our Facebook community. And on Instagram, they can find me at Dr. Heather Stone.
And are you seeing patients in person in Houston as well? Or do you do mostly a digital presence?
It's our clinic is now all virtual, and we see patients in about 9 different states at this time. So the way that people enter the practice is really through the Facebook group. So really getting that baseline of education and understanding, and then working into the practice that way. So if they wanted to be considered for becoming a patient, then they would go to the Facebook page.
Wonderful. All right. Well, Dr. Stone, thank you for your information and sharing this and doing what you do, because I think we got a lot of people that are probably mismanaged, and it's good to get somebody that's actually treating some of the root cause stuff, which I have a big, a big passion for myself. So thanks so much for doing this. I really appreciate it.
Absolutely. Thanks for having me on.